kids were little. We came here because we were in need. We couldn't afford insurance. And it was really a blessing for us because I don't know what we would have done without it.
Good. 98.3?
We've pretty much grown here. It's like the one familiar place. It just offers so many things you need for a healthy life.
Okay, try not to squeeze your fist, all right? And just keep your hands still and
I'm very fussy when it comes to anybody working on me. And so I really feel comfortable here. It's really a perfect place to get taken care of when you don't have a lot of money.
Perfect, and one more time, right here at my hand.
Since everybody knows me, everybody always asks, do I need something? And if I was sick or something, I wouldn't have to wait that long to see a doctor. I feel very comfortable coming.
Hi, sweetie.
I've been here a long time. All my children, all 5 of them now, because I have a 7-week-old. And with or without insurance, it's a good place to be.
Cutie. Look at her.
I had never been to the Open Door before. I'd only heard about it. It did make me realize how many people are in need and what a great thing it was that there was a place where there's doctors and nurses spending their time and their talents to put something back in the community.
The community now knows that someone cares about those who really can't afford private doctors, and they provide the same quality of service, if not better.
Okay, Jason, we'll start from the top.
Open Door has a sense of mission, and the mission is to care for the underinsured and uninsured. Here we have a sliding fee scale depending on the income. And there are some people who would not get any medical care because of the prohibitive cost if they were not coming here.
People who don't have insurance are worried about how they're going to pay for the services, and they won't come to the doctor unless they absolutely have to. And when you're talking about people who are from other countries and who don't speak the language, there's a whole level of education that needs to take place, and the best way to do that is when they're here. When they're in the middle of the crisis, when they don't quite know what's going on, our reps are there to try and straighten things out so that they don't have that problem in the future.
If Open Door didn't exist, the uninsured could walk into an emergency room of any of our local hospitals, but the expense is going to be much, much greater. And of course, those bills are still going to have to be paid by taxpayers.
We understand what taking care of a population of patients is all about. For example, we have our Diabetes Collaborative. We put all of our patients into a registry.
Those are your blood sugars, yeah. And ones that you checked earlier?
And so we know at any given time how many diabetics we have, how well their sugar is controlled. It's a wonderful model of care that ultimately saves taxpayer dollars, because when people are well cared for, they use the system less and they're more empowered to care for themselves.
It went down. That's fabulous.
This is Christopher. Since he was born, Dr. Pace has been taking care of him, and he loves her. And all of my siblings went here, my sisters, my brother, my mom.
When you hear the beep in your ear, you're going to say yes, okay?
Yes.
We always knew we wanted to do family practice. We wanted doctors who could see the whole family.
Our staff is trained to really understand the family as a single unit, from the newest member, the infant in the family, all the way through to the grandparents or even the great-grandparents.
Say cheese.
Cheese.
I really love having the mom and the kid come in, and they're both my patients, and I can look at one while I'm talking to the other one and be taking care of the two of them at the same time. It's a very exciting kind of practice.
This is a multi-service organization. We have an optometrist, we have a podiatrist, we have prenatal care, we have family practice doctors.
Even if somebody...
We have social workers that deal with mental health problems.
But no psych history that you know of?
And we have dentistry.
We're going to check your teeth, okay? And then it's going to be very easy, so don't worry.
Motivation really comes from a sense of mission and a sense of joy and pride in the work that you're doing. And that's all pretty easy here because we're doing such important work.
Open Door is not taking on the cost of the medication.
We are a family. We work as a team. We treat everyone with respect. I'm here for you, you're here for me to help our patients 100%.
Now, nice and tight, right?
Since 1972, everybody's working so hard to reach this goal.
You like them? How do you feel?
Good.
In my years with Open Door, I see so many good things happening here. This is a great cause that deserves everyone's help. That's why you see me still here.